After Father's Day weekend, one local dad will hold his children a bit tighter this year. This healthcare administrator usually makes sure others receive exceptional care, but recently he had to lean on others during his battle with COVID-19.
So I just quarantined myself in the room, and I told my wife and the kids, don't come in.
In September, Irshad Khan's case of COVID-19 just kept getting worse.
The temperature's going up and the oxygen levels going down, so I said, yeah, I think it's time to go to the hospital.
We knew people were dying across this country. So of course I was terrified.
Khan knows what it's like being in a hospital. He's the director of provider relations at Centerpoint Hospital in St. Charles County. But being a patient was a first.
I was not doing too well because it really affected my lungs, and it was, I was on oxygen in the hospital and all the steroids.
After 10 days, Khan returned home, but then
I was going downhill, and we called a pulmonologist, and then my lungs were, after I got that, my lungs were totally infected with the double pneumonia, which I had in the hospital, but it seemed to increase when I got out of the hospital.
Doctors put him on oxygen for 5.5 months. He says he's now about 85% recovered.
There's times when I do feel short of breath, and the fatigue is something that really was affecting me a lot.
Someone who I love very dearly got really sick, and we went through a horrible time. And if we can prevent another family from having to experience what we went through, the vaccine is a godsend.
I'm just blessed to have my family support, my neighbors, my community support, my colleagues at work. Everybody's been wonderful to me during this time.
And Khan's wife, who you heard from, actually tested positive with the coronavirus while her husband was in the hospital. She didn't tell her family because she didn't want to add more stress. Luckily, her symptoms were very mild. She's okay, but they're just happy to be together this Father's Day weekend.
Happy for them as well.